Our goal is to prepare our fellows to be successful once they graduate and leave Duke and go on to exciting lives as faculty. And the field of GYN oncology is constantly evolving. New medications, new innovative surgeries. And so as faculty here, our goal is to expose our fellows to all of those things so that they're prepared to take on whatever comes at them when they're finished.
So in terms of their education, we start in their research year. That's a dedicated year that they have. They do not have call during that time. They really can focus on whatever research they want to look into. So for example, we have experts in translational and basic science if the laboratory is a place they want to be. We have experts in clinical and health outcomes research if that's something they'd like to focus on. We also have expertise in QI, quality improvement initiatives, and so they can work that into their year as well. In addition to the research time, we have dedicated teaching didactics time that happens 4 times a month for our fellows, and we use the ACGME competencies to make sure that we cover all those areas, but then we also like to be more fluid, and if faculty or fellows have areas that they feel like they need to learn more about, for example, if a new paper came out that was interesting they want to talk about with us, and we make sure that we integrate that in as well. So in terms of our curriculum, in addition to the dedicated 4 times a month that we also have weekly tumor boards where the fellows are expected to lead and the clinical discussion about the treatment for our fellows. That means that they will, review the relevant clinical trials, the data, the, new therapeutics that might be options for those patients. We also have journal clubs that are quarterly when we cover kind of relevant topics for them as well.
One of the exciting things in our program is the simulation offerings that we have for our fellows. For instance, we have a partnership with the general surgery department, and we're going to be doing robotic vivarium simulations so that our fellows have opportunities to practice some of the more rare and complex procedures that they may encounter as GYN oncologists, but in a setting that feels safe to practice before they're taking care of patients.
So during the last 2 years of our fellowship are the clinical years, and during that time, our fellows are focused on care in the outpatient setting, in the inpatient setting, and in the operating room. So in the clinic, they see a variety of different patients. They go through treatment options. They help with surgical planning, surgical approach. In the inpatient setting, we really expect them to be the leaders of our inpatient team. They lead rounds. They make the daily decisions about the care of our patients. And in the operating room, we're very lucky that we have a wide variety of techniques that we use. So we do open, traditional straight stick laparoscopy, as well as robotic laparoscopy. That really gives our fellows the ability to know kind of cutting edge, novel approaches for surgical care.
So our fellows spend each week 3 days in the operating room and 2 days in the outpatient clinical setting. And each 3 months, they'll spend with a particular attending. So they have opportunities to get used to and learn from those attendings how they like to work in the operating room before they have to switch back.
They also do a month of brachytherapy with our radiation oncology attendings to learn the basics of that approach so they can help counsel patients on what to expect. We think one of the big strengths of our program is really that, to start in the research year, that we really try to tailor things to our fellows to make sure that they can focus on the area that they want to focus on, that I think will help them develop their careers in the future, and really hopefully kind of ignite an interest in areas that they may not, have realized before. We also have very dedicated faculty who are just very committed to the success and the growth of our fellows, and I think that's really wonderful.
I think another unique thing about the Duke GYN Oncology program is just the collegiality and the opportunities for collaboration. I feel very fortunate when I come to work that I'm coming to work with friends. And we all have the common goal of taking excellent care of our patients, and it makes some of the challenges of being a GYN oncologist a little bit easier. Additionally, we have faculty who have young children and who may or may not have had children during their training. And so it's a great opportunity for mentorship, just for fellows to see what life may be like as a parent surgeon.
One important role of our fellows, in addition to patient care, is actually mentoring and teaching our residents. And so we expect them to do that on the inpatient service when they're leading rounds. In the operating room, we want to be able to guide them to take the residents through the case independently so that they can become teachers in the operating room after they graduate.
One of the things I'm most proud about of our fellows is that they are truly dedicated to education, both in the inpatient and outpatient setting. For example, over the last 5 years, more often than not, our fellows have won education or teaching awards at graduation, which just speaks to their dedication towards the educational mission of the department.
Really, as the field of GYN oncology has become, more and more wide in the areas that it covers, we just want our fellows to feel like they have expertise in the variety of things, from palliative care to surgical training to novel therapeutics to, basic chemotherapy. And we really just want them to feel like they can leave this program with a strong foundation in that, and also feeling like they have had the exposure to the things that they can choose the career path that they want to follow.
And another important thing is that once they graduate, they are part of the Duke GYN Oncology family for life, and that if they ever have any questions or concerns or other collaborative opportunities, that we are always here to support them throughout the entirety of their career.
And we definitely encourage them to reach out to us, once they're gone, just to check in or to tell us how they're doing or to ask us questions. And we tell them very much that we're here for them, and we truly are.